Hello everybody, today we're going to do something short, something very powerful, because one of the things we always talk about that surgery is psychomotor skills, cognitive skills, and mindset skills. Psychomotor skills, there is a lot of hand biomechanics, how to grab an instrument, how to navigate in the anterior chamber. Cognitive skills are more about the decision making and problem solving, and mindset is about to be focused and to manage anxiety during surgery. Right now, we're gonna go very deep in the psychomotor skills. As you can see here, look at this. The doctor is navigating in the anterior chamber, and you are seeing a visualization that probably never saw before, because it's a 45-degree visualization of what's happening in the anterior chamber. So she needs to do what we call the precision test. She needs to go with a pointer and get inside a 3D ball in the anterior chamber, and with a lot of precision, she needs to get in until it changes color without going out. This is so powerful for training. And then you can see there in a 2D, we can also train it in a 3D visualization system. And this is extremely important. In the other hand here, you're going to see another great colleague, but doing all the training, guess with what? With the non-dominant hand. So you can see, the non-dominant hand position and the power of training when you want to do, Phaco chop and many other complex things. I want you to see the screen there too, with a great colleague that is Dr. Haber, who is kind enough to create, look at that, an app in order to understand if your hands are correct or incorrect. And we're gonna be launching that pretty soon so you understand your hand biomechanics. Here is something we really love. Look at this. So we created a completely new training for the hand biomechanics. In this case, look at the power of this. We're gonna do this movement in order to make all the thumb and all the muscles that can control it, okay? Very strong. This is something you can, buy in any place, and you can train yourself. And when you release it, you're gonna also train your wrist. Here, great movements for your hands, like this or like this. Again, for your hands. Okay, you need to have all those muscles perfectly. And here, this is one is more complex, but it's gonna train your fingers. Okay, extremely important what we're gonna do with psychomotor skills. Again, look at the hands of our colleagues, look at the precision test, look at the non-dominant hand. And let's go here just a little bit and really quick about what is happening here, because this is something we are not very used to train. And this is something so important that sometimes, we have this way that we think, well, I'm going to go to the operating room to learn. The perfect place to learn is the operating room. Guess what? I'm going to make a strong point here. Why? Simulation and a simulated environment with high fidelity, but most of all, when you can put your hands, again, remember, hands, instruments, incision, and anterior chamber working together, this is where you learn. Why? Because if we go for the psychomotor skills, as we said in the past, how we learn to do a movement, we call it a generalized motor program. Okay? And this is an abstract representation of the movement. So in our minds, we need to know, let's say, capsular rhexis. We need to have the abstract representation of what it is. To do that, the thing we have in the middle is called parameters. Okay, so we need to know parameters. We need to know if that capsular rhexis is going to be done in a deep anterior chamber, shallow anterior chamber. What's the elasticity of the capsule, the state of the sonula, and how it behaves if we have pressure in the lens or if the video is pushing up, which kind of viscoelastic do we have? Those are all parameters actually about the forceps we have and the way we can pivot through the incision and we're not removing viscoelastic from the anterior chamber. All those things are parameters that we really need to understand. We understand that and we need to master that with time. But in the center here, we have something called the schemata. Okay? And the schemata are the rules to do a motor skill. Okay? This is motor skills. Okay? And these rules and everything we need to learn, it's very important to have one of the things I like the most about a surgeon, and when I think they're, masters of their craft, that is what? It's adaptability. Everything you want to learn, adaptability. Adaptability. Okay? When you see an expert, it looks like he's always doing the same. Well, guess what? No, he's adapting to every single case and he knows how to do it. In order to do that, look at this. And this is the real power of simulation. First of all, is that motor skills are error-driven. So we learn mostly by mistakes and to put limits in what is correct and what is incorrect. So a simulated environment is the place to learn. And this is what is going to also be connected with the parameters. Okay, the other thing is going to be correct, it's going to help us with the limits and to learn the parameters. It's contextual interference. And this is exactly what we were talking about. What we were talking about doing a capsulorhexis in completely different scenarios. And think about it. In one morning, we have one of the students right here who can do 200 or 300 capsulorhexis, but in different situations. High tension, low tension, white cataract, weak sonula, and many other things, okay? But most of all, we can do rescue maneuvers, and we can do enlargement of the rhexis, and we can do a posterior capsulorhexis. That is something that we don't do very often. So with one surgical task, we understand that the place to learn is in a simulated environment. And finally, to understand everything, we need to understand that practice makes permanent, which is something we don't like. We want to make perfect. So only perfect practice makes perfect. And this means that we need to have something called deliberate practice. Anders Ericsson talked about this many years ago. And deliberate practice is something we really need to do with a structure. In the center of deliberate practice, if it's a wheel like this, right? We need to understand that in the center of deliberate practice, there is two things: a mentor and feedback. A mentor and feedback. So guess what is happening here? She has a mentor, and when she finishes, she's going to have objective and subjective feedback. Okay? She, in her example, is training in a very difficult environment with the non-dominant hand. That can only happen in a simulated environment. So again, for everybody who is out there, try to understand these concepts. Try to understand that simulation is the way, that you have high fidelity simulation, not only with virtual reality, but with artificial eyes, and find yourselves a mentor and find yourselves a way to have feedback on what you do. And if you really think about it, and this is the final concept I want to take, to understand this and to learn schemata that is error-driven, okay, it's going to take years in the operating room. In a simulated environment, it's going to take maybe weeks, okay? If you have the mentor and if you have the feedback, you're gonna create the abstract representation in the best possible way in order to be adaptable. And just to finish, this is only the psychomotor skills. Imagine what happens with the cognitive and the mindset. So thank you, and I hope I can give you a little bit of value in not only in your learning curve when you are doing your first tasks, but maybe if you did 100, 200, 500 cases, there is always something new to learn, or maybe a new technique. Maybe you're an expert and you want to learn a new technique. The way to do it is in a simulated environment. Okay, so thank you very much.